Welcome to Beyond the Basics, a project at the Center on Budget and Policy Priorities that's designed to help prepare consumer assistance groups and others to assist people in understanding the Affordable Care Act's health coverage options. Today's video is about subsidy eligibility for certain lawfully present people who don't meet the strict Medicaid immigration requirements. I will cover both eligibility policy and the application process that is used on healthcare.gov. Although generally individuals must have income above the poverty line in order to be eligible for premium tax credits, the Affordable Care Act includes an exception for individuals who are lawfully present but ineligible for Medicaid based on their immigration status. This exception was created to make sure that all lawfully present individuals had a pathway to coverage, but there was no interest in expanding eligibility of immigrants under the Medicaid program. So who is lawfully present but not eligible for Medicaid based on their immigration status? Well, this could be a lot of people. This could include individuals who are lawfully present but don't have a status that's qualified, and that's a standard that's used under Medicaid. Or it could be an individual who has a qualified immigration status but who is subject to a 5-year wait before they can become eligible for Medicaid, but they have not met that 5-year wait yet. I'm going to break this down, who is a qualified immigrant and who is subject to the 5-year bar in coming slides. But the bottom line here is that there are a lot of lawfully present people who don't meet the strict Medicaid rules and are eligible for marketplace subsidies, even if their income is below the poverty line. Though many people are eligible, it is not always easy to get the correct eligibility determination. I've sketched out 4 steps that I hope will support your efforts in helping eligible consumers get the right determination. The first 2 steps are focused on figuring out who is eligible for premium tax credits, even if their income is below the poverty line or in the Medicaid range. And the last 2 steps are focused on navigating the application process. First step is to figure out if a person you are trying to help is eligible for Medicaid based on their immigration status. In general, Medicaid is stricter than the marketplace when it comes to citizenship and immigration status. For the most part, people must be U.S. citizens or in an immigration status that is considered qualified. This includes people like lawful permanent residents and folks that are listed here, and often times these are the folks that are here for some type of humanitarian reason that includes refugees and asylees, Cuban Haitian entrants, as well as others that are listed here. But that's not all. Many immigrants also have to wait 5 years after getting their qualified status before they're eligible for Medicaid. It's important to note that there are a lot of qualified immigrants that are not subject to the 5-year wait. We've listed them here. Oftentimes, they're people who are in the U.S. for humanitarian reasons, like refugees or an asylee or a person granted withholding from deportation. But there's also people who are not subject to the 5-year bar because either they're U.S. veterans or they're on active military duty, or they are the spouse or the child of a veteran or an individual that's on active military duty. And at the state's option, there's a few other groups, including children and pregnant women, that may not be subject to the 5-year wait as well. States have some flexibility to be less strict about their immigrant-related eligibility for children and pregnant women. They can extend coverage to a broader group of immigrants who are considered lawfully residing in the U.S. This option uses the term lawfully residing, but the standard matches the standard for marketplace enrollment, which is lawfully present. And I'll cover more in depth who is considered lawfully present in the next couple of slides. It does include everybody who has a qualified immigration status, but it also includes people who don't. There is also some flexibility that states have to be even stricter than the federal Medicaid eligibility requirements. And in that case, it results in fewer lawfully present adults being eligible for Medicaid. So there are certain expansions that create, for children and pregnant women, more people who are going to be Medicaid eligible, and then there's certain restrictions that only a few number of states have, where they can be less welcoming to individuals, and they're stricter, and that results in more people being ineligible for Medicaid based on their immigration status. Like I mentioned earlier, the marketplace is less strict about immigrant status eligibility. Immigrants are eligible to purchase coverage if they are in a status considered lawfully present. This includes everyone who's eligible for Medicaid based on their status, and many others that are listed here on the right-hand side of the chart. Note that even though people with deferred action are included in this list of folks who are lawfully present, folks who get deferred action under the DACA program are not considered lawfully present. Certain people who are in the process of applying for immigration status are also included in the list of those considered lawfully present. So we're talking about a lot of different groups that may qualify for marketplace coverage but will not be eligible for Medicaid. Let's put it all together and walk through an example. We have Gina, Adnan, and Sam in this family. Gina is from the Republic of Marshall Islands, which is a nation covered under the Compact of Free Association, also known as COFA. Adnan entered the U.S. as a refugee 4 years ago, and he gained lawful permanent resident status last year. Both Gina and Adnan are full-time college students and both work part-time jobs. They project that their income will be $18,000 for 2018. It's going to put them at 92% of the federal poverty line. Gina and Adnan are applying for coverage for themselves, but they're not going to be applying for coverage for their son, Sam. He's a U.S. citizen, and he's already enrolled in CHIP. So we're going to just focus on the two parents for this scenario. Let's walk through their eligibility based only on their immigration status. First, we have Adnan. He's applying for coverage. He is not a citizen. He is a refugee, and he has lawful permanent resident status. As both a refugee and a lawful permanent resident, he is considered a qualified immigrant for Medicaid purposes. As a refugee, he's not subject to the 5-year bar. This is true even though he has become a lawful permanent resident. You don't lose your refugee status that exempts you from the 5-year bar even when you adjust your status and become a lawful permanent resident. This means that Adnan meets the Medicaid immigration-related eligibility requirement, and he meets the immigration requirement for enrollment in the marketplaces. Now let's look at Gina. She's applying for coverage. She is not a citizen. She's from the Republic of Marshall Islands, which is covered under COFA. This status is not considered qualified for Medicaid purposes, but she is lawfully present and is therefore eligible to enroll in marketplace coverage based on her immigration status. She's an example that we've been talking about. She's lawfully present but not eligible for Medicaid due to her immigration status. Let's look at both income and immigration status to see their eligibility for Medicaid based on both of these factors. Adnan is a lawful permanent resident. He entered the U.S. as a refugee. He's not subject to the 5-year bar. He meets the Medicaid requirement based on immigration status. His household income is below 138% of the federal poverty line. He lives in a state that has expanded Medicaid. He is eligible for Medicaid. Gina does not have a qualified status for Medicaid, so she's not eligible for Medicaid based on her immigration status. So we figured out that step number 1. We figured out that Gina is not eligible for Medicaid based on her immigration status. Now let's see if she's eligible for marketplace subsidies. Gina is lawfully present, so she has an eligible immigration status for marketplace coverage. That is step 2. We figured that out now as well. She's eligible for premium tax credits, though her income is below 100% of the federal poverty line because she's ineligible for Medicaid based on her immigration status. So now that we know that Gina is eligible under this special rule that we've been talking about, the next step is helping her to complete the application. On the application, Gina will be asked if she is a U.S. citizen, and she will say no because she's not. She will then be asked to identify if she has an eligible immigration status, and she will indicate that she does because she has a status that makes her eligible for marketplace coverage. Her status is considered lawfully present. She will then be asked to select a document from a list of documents that immigrants might have. In Gina's case, we will say that she has an electronic arrival departure record and a foreign passport. Gina selects the arrival and departure document and she inputs her I-94 number. Healthcare.gov will then use Gina's information that she's provided on the application to attempt to verify her eligibility electronically with data that is held by the U.S. Department of Homeland Security's SAVE system. So now to step 4. We want to look at her eligibility determination notice. Generally, if healthcare.gov can verify her status in real time, that is what I mean by that is that it could verify her status while she's completing the application. If that can happen, she's going to get the correct determination of premium tax credit eligibility. However, there are a lot of people who can't get their status verified right away for a variety of reasons, a lot of reasons that are of no fault of her own. There are just certain limitations in all of these electronic data matching. When this happens, healthcare.gov looks at the consumer's income. If their income makes them look like they are in the Medicaid range, then healthcare.gov will assume the consumer is fully eligible for Medicaid based on their immigration status. So in this case, we will assume Gina's status was not verified successfully through data matching. And so healthcare.gov thinks that she's eligible for Medicaid and then sends her file to Medicaid. And it indicates that the state will ask her to send some documents to prove her status. The state will then ask her to turn in some documents to prove her status, and we assume that Gina will then turn in those documents, and once the state has those documents, they will process those documents and will eventually deny her Medicaid eligibility based on her immigration status and will send her back to the marketplace. Once the Medicaid agency denies her Medicaid based on her status, she will also receive a notice from the marketplace explaining that she will need to return to the marketplace. Gina must return to the marketplace either online or by the call center, and she will be asked if she has been denied Medicaid eligibility based on her immigration status. And she should say yes if she has been denied. This question is going to pop up within the regular stream. It's not like it's going to be because she's in this circumstance, the first question that pops up is this one. That's not how it works. It's just another question that pops up, and she will see it when she goes into her application at the marketplace. So here are the steps that we just went through for Gina. Keep in mind, in this example, Gina lives in a state that has expanded Medicaid. So with income at 92% of the federal poverty line, she appears income eligible for Medicaid. Healthcare.gov was not able to verify her status electronically, so it assumes that she has an immigration status that makes her eligible for the program that she's income eligible for. So healthcare.gov assesses her eligible for Medicaid. Then healthcare.gov sends her file to the state's Medicaid agency. The Medicaid agency asks her to send in documents to prove her status. Gina sends in the documents that proves her status. Medicaid denies her Medicaid eligibility because of her status and sends her back to healthcare.gov. The marketplace sends her notice instructing her to come back to the marketplace. Gina goes back to healthcare.gov and indicates that she has been denied Medicaid eligibility based on her immigration status. Gina will then get the correct eligibility determination from healthcare.gov. In this example, we said that Gina is in a state that expanded Medicaid, but this is the same process that's also used in states that did not expand Medicaid if the individual otherwise appears to be Medicaid eligible. For example, a parent with very low income could go through the same process in a state that did not expand Medicaid. Let's look at what happens when a person like Gina is in a state that has not expanded Medicaid and does not otherwise appear to be income eligible for Medicaid. We have Adnan and Gina again, but now they live in a state with no Medicaid expansion. The situation looks different for Adnan. He still meets the immigration requirement for Medicaid, but he is not eligible for Medicaid because his state did not expand, and he does not meet the very restrictive income eligibility requirements for parents. He's not eligible for premium tax credits either because his income is below the poverty line. Nothing changes for Gina. She remains ineligible for Medicaid due to her immigration status, but is eligible for premium tax credits even though her income is below the poverty line because of this special rule. She is lawfully present but ineligible for Medicaid due to her immigration status. We go on to step 3 for Gina like we did before, and we help her complete the application. She provides her I-94 number. Healthcare.gov will try and electronically verify her status. If she did not have a data matching issue, she would likely get the correct eligibility determination. In this case, we'll say that she did not. So you'll have to help her take the extra steps. Gina's eligibility determination notice will indicate that she can purchase a marketplace plan right away, but with no premium tax credits, which, as you can imagine, won't work for a person with income at 92% of the federal poverty line. It would be way too expensive for her to afford the premium unless somebody was able to help her. She is also told that she may be eligible for premium tax credits, but she must turn in documents to prove her immigration status. Gina uploads a copy of her electronic arrival departure record. That document will be reviewed by the healthcare.gov staff, and they will determine if she is ineligible for Medicaid based on her immigration status. And if they do determine that she's ineligible for Medicaid based on her immigration status, she'll then be determined eligible for premium tax credits. Here's a summary of the steps Gina just went through, assuming now that she's in a state that has an expanded Medicaid and assuming that she doesn't otherwise appear to look like she met the Medicaid requirements. So healthcare.gov determines her eligible to purchase a plan with no premium tax credits, but said that she may be eligible for premium tax credits, but she'll have to send in documents to prove her status. If Gina sends in proof and healthcare.gov determines that she's ineligible for Medicaid based on her status, she's awarded premium tax credit eligibility. So it's difficult for folks who are eligible for premium tax credits with this very low income if their status can't be verified in real time. Some steps that you can take to help increase the chance of being successfully verified in real time include: answer as many questions as possible in the application, and answer them as completely as possible as well, and as accurately as possible. Double check how immigrant document numbers were entered. It's not always easy or intuitive to identify the correct numbers to use. We have a guide to identifying document numbers on our Beyond the Basics website that may be able to help out in figuring out which numbers to look for. Compare the spelling on the document, the documents that you're using to the spelling that's on the that's being used on the application. That can sometimes yield data matching issues. Complete identity proofing. This gives you full access to the online application. More mistakes can happen when you are sharing information over the telephone. We've even heard about call center operators skipping important questions in the past, like requesting immigrant document numbers. If there's more than one adult in the household, have the person that's most likely to have a credit history be the person to file the application, so that they would be that person who would be identity proofed online, and you'll improve your chances of being able to successfully be identity proofed. For people who get the wrong eligibility determination that we've talked about during this webinar, if you are absolutely certain that this person is ineligible for Medicaid and based on their immigration status, and they've gotten the wrong eligibility decision done by the marketplace because of this system limitation that we've been talking about. If they can honestly say that they have been denied Medicaid eligibility due to their immigration status since October 1st of 2013, and you're again absolutely certain that they still don't meet that Medicaid eligibility requirement, then they should answer this question accordingly. This, like as I mentioned beforehand, is a question that's in the application that pops up as folks are, proceeding through the application. I want to just add a little bit more caution to this because, October 1 of 2013 was a long time ago, and people could have gotten denied Medicaid eligibility since then based on their immigration status, but have since had a change. Maybe they met the 5-year bar now, or maybe they became a citizen or something else. It's really important to both make sure that, one, the person really was determined ineligible for Medicaid based on immigration status, and two, that the person remains ineligible for Medicaid based on immigration status before indicating that they have been denied Medicaid eligibility using this question. But there are certain people that are clear, like, for example, Gina, who has COFA status. If she was, last year she came to the marketplace, and the marketplace made a determination of eligibility that she is not eligible for Medicaid. If she were to have the wrong determination done again this year, she's somebody who can honestly answer this question, and there's very little risk because somebody with, that has COFA status, it's not like what's stopping her is like a 5-year bar. It's that she has a COFA status, which is not a status that's eligible for Medicaid. So it's pretty clear. Finally, in a small number of states, the rules for accessing Medicaid for adults is even stricter than the federal rules. If you're not in one of those states, you don't have to worry about this last slide. You can turn off the video. But if you are in one of those states that further limits Medicaid eligibility beyond, just making sure that people have a qualified status and making sure that if they're subject to a 5-year bar, they meet that status, that they're even stricter in your state. And oftentimes, when you're in one of those states, but you can also use the links to the report that we had earlier in this video to find out whether or not your state has some additional restrictions. And you can always reach out to us as well. We can help you find out whether or not your state has these additional restrictions. For those folks, 2 different ways that states have further restricted eligibility for immigrants includes that, for individuals who have qualified status and are subject to the 5-year bar, some states also require that you have completed 40 quarters of work and gotten credit for 40 quarters of work through the Social Security Administration before you qualify for Medicaid. And another limitation that some states have, again, a very small number of states, is that they limit the number of years that individuals who are refugees can qualify for Medicaid, and they limit it to 7 years. So basically, as of the date that you become a refugee, you cannot be in Medicaid after 7 years of that date. So if you're in one of those states, I think healthcare.gov has additional challenges in getting this eligibility determination done correctly. In some cases it does, and no problem. In other cases, it doesn't get it correct. What we are hearing from assisters across the country in these, small number of states, when this happens, really the best strategy right now is to have the person get a denial of Medicaid eligibility from the state. So even if you've completed the marketplace application and they just are assuming that this is a person who's in the coverage gap, you may also want to complete a Medicaid application, get the person to have a denial, and then come back to the application and indicate that the person has been denied Medicaid eligibility based on their immigration status. With that, we are going to conclude this video, and as always, we welcome you to reach out to us on Beyond the Basics with any kind of questions that you might have, or if you want additional information about this policy and application process, as well as any others. We thank you for your time.